Welcome to CFRI's Cystic Fibrosis Community Voices, a video podcast series created by and for the cystic fibrosis community.
My name is Elise L. Conan Goldberg, and I have CF. I'm 62 years old, and I am 8 years post a double lung transplant. I would like to introduce you to our little puppy, Teddy. He's a little Maltipoo that we got about a year ago in the throes of COVID. He is definitely the silver lining to COVID.
Hi, I'm Becca Runhouse. I'm 32 with cystic fibrosis, and I'm so excited for this podcast because obviously I'm obsessed with dogs. I have 3. I have a dog shirt on. Dogs just help you no matter what. They're super emotional support. They know when you're not feeling well. Ripley used to do my vest with me, but now he just randomly checks on me during it. Just them cuddling helps you. You can talk to them and they don't judge you.
Greetings, everyone, joining this pet podcast from near and far. My name is Meg Dvorak, and I'm the social worker for the adult CF program at Stanford Healthcare, along with my esteemed colleague, Kate Yablonsky. We just wanted to develop a best practice approach for CF providers and the whole CF community.
So let's start with some terminology, because a lot of these, Meg and I have found, get very confused. People get them confused. So a pet, self-explanatory. That's just the pet that you own, your companion.
So dogs, to me, just means happiness. If I were to look up the definition of happiness, Lila, stay. She doesn't want to cooperate. She needs treats. They're very food motivated. So just holding them like I am right now, just having them sit next to me is great. Petting them makes me happy. They visit me in the hospital, which I mentioned earlier, which even though I don't usually have all 3 go to the hospital room, just going outside is great, which also provides some fresh air. There's days where they can't come visit me, so I would simply just go outside to see if there were any other dogs that I could pet. I've had friends bring their dogs. So even though my dogs provide the greatest happiness to me, seeing other people's dogs does too.
A wonderful thing about having a pet is you really never feel alone. Teddy and I have so bonded over enrichment playing. I do balls where I put them in muffin tins and there's food underneath them, or puzzles. We do a lot of training with sit and throwing the ball. But one of the best benefits, I would say, is that a dog, it gives you a reason in the morning to get up. And it's been hard this last year when we've not been able to do a lot of our normal activities. And with a dog, you have to get up and let them out. I have a routine that we go walking or hiking every morning, but getting out in that fresh air and getting the exercise, not only for yourself, but for your dog, is just priceless. You often meet people along the way that you can have little conversations with, and there's other people that you'll interact with. Hopefully your dog, this also is a wonderful way for your dog to get socialized, which has been a challenge during COVID. But most importantly, we know that we need to exercise. And if it weren't for Latte all these years, I honestly don't know if I would have reached the old age of 62.
A service animal is a dog that is trained to work or perform a task for the benefit of a person with a disability. So these are like your seeing eye dogs, your seizure dogs, things like that. An emotional support animal is not a service dog, but a companion animal that provides a therapeutic benefit to someone with a mental or psychiatric disability. And a therapy animal is an animal that provides emotional comfort through an organized pet therapy program, usually at hospitals, nursing homes, chronic care facilities, things like that.
This is Lilo. She's my oldest. I got her as a puppy, and she is now 13 years old. She is a Malamute Corgi. She acts more like a cat. She's there when you really need her, but also we'll just let you pet her when she wants to be pet. This is Lola. She is a cockapoo. She is 11 years old now. She's pretty affectionate, loves everybody, but is the most food motivated dog ever. She is always hungry. She acts like she's on prednisone. So Ripley right here is a cute story. He was in a vet tech program I was in. He was one of the dogs that the school adopted from the shelter to help students kind of learn and teach and whatnot. And he was not really loved by anyone. He was kind of a jerk, but he knew that I was a sucker. And my parents had said, no more dogs besides these two, you have to promise. But I just fell in love with him. And so I brought him home a weekend and he did fine. And then I brought him home over spring break. And I told my dad, if he goes back to school tomorrow, he's gonna go back to the shelter. Well, the reason my dad let me keep him is because he became kind of our therapy dog, where he would do my treatments with me, he would visit me in the hospital, and now he's become a therapy dog for both my mom and my dad.
I will say that the bonding aspect of dogs love your time. They don't really care so much about, how expensive their toys are or what fancy leash they have. What they care about is that you spend time with them. And I know that Latte and Teddy both loved when we play ball, we do hide and seek of food. And it's also fun for me because my activities definitely have become more limited with COVID. And this has turned into a really entertaining aspect of my life in the last year and a half. There's a lot of things that go into having a dog in terms of other responsibilities than just the pure pleasure of owning a dog. I am a firm believer that they become a permanent part of your family and it's a forever responsibility. There are quite a few expenses when you go to think about getting a pet that you need to think about, especially if you don't have access to friends or family who, for example, you have a hospital admission and you need to leave your dog with somebody, you've got to think about that. Leaving a dog with a dog sitter can be expensive. For sure, their vet bills can be expensive. You have to be prepared that things happen. Initially, if you get a puppy, you are going to probably need to be responsible for spaying or neutering them, and that is very expensive. So it's not something to just do on a whim. It's something to think out a plan and understand how you can do it the most safely as well as financially if you can afford to have a dog.
So first, I'm going to talk about service animals. So service animals have been around for over 100 years. They date back to the military and like the first seeing eye dogs. But now there's service areas for all kinds of medical conditions, such as seizures, PTSD, cancer, and diabetes. And there are ADA laws that were written many years ago to cover these animals for people with disabilities. And there's a lot of sort of misunderstanding about these laws. And we think they're like sort of vaguely written just to help accommodate people from a variety of backgrounds so they can have access to these animals to help them function effectively in their homes and in the communities. And to verify if an animal that's with somebody is a service animal, people in public places or establishments have the right to ask two questions. The first one being, is this service animal required because of a disability? And then the second question is, what work or tasks is the animal trained to perform? And the person with the animal is not required to produce documentation, although many people do have documentation of such animals.
This is Lilo, like I mentioned earlier, and we have a very special bond. I've had her the longest. She's 13. I got her at 8 weeks old. And the reason I named her Lilo is because I'm obsessed with the Disney movie Lilo and Stitch. And the reason I'm obsessed with that movie is it helped me like no other through one of my first major GI surgeries. I had a bunch of scar tissue that was pinching my intestines closed, and the surgery was supposed to be an hour and a half to 2 hours, and it ended up being 9.5 hours. So I ended up with like a bed sore to the bone on my butt. I ended up with some on my heels, and then just recovering from the surgery alone took a while. And that movie helped me through so much of that hospital stay, and since, like, anytime I feel down or not good, I'll rewatch the movie. And so whenever I say her name, I just think of how much that movie helped me and how much she helps me.
Emotional support animals, on the other hand, do require documentation in certain circumstances. So ESAs were talked about a lot a few years ago. You would hear about it a lot in the news, especially around people taking advantage of this kind of classification. It's not so much in the zeitgeist anymore since COVID. I think the world had bigger fish to fry, but a lot of people have very strong opinions, both positively and negatively, about emotional support animals. But again, like Meg said about service animals, there's a lot of misunderstanding about what an ESA is. So an emotional support animal is specifically for a mental health impairment, and to have an animal certified as an ESA, you have to get documentation from a mental health provider that is treating you for a mental health disability that confirms that the animal helps with your mental health impairment. You don't get any special access to public places with an emotional support animal. It doesn't have to have specialized training. It doesn't do a task or work. The main reasons you would want an emotional support animal is related to housing, to be able to have your animal where you live or in a hotel, something like that, or to fly. And we'll talk a little bit more about both of those situations.
So service animals must be permitted into all tenant agreements, and this is under ADA law. And then the HUD law defines an ESA as an animal that provides emotional support that alleviates one or more identified symptoms or effects of a person's disability. And Kate and I take this to mean that the disability is the medical condition such as CF, and the symptoms would be the mental health impairment that is associated with the CF, such as isolation, depression, anxiety, lack of motivation. And so similar to the service animals, the emotional support animals are sort of lumped into this as a reasonable accommodation in housing agreements. And the landlord is permitted to ask 2 questions that you see here. Does the person with a disability have an emotional impairment that substantially limits one or more activities? And does the person have a disability related need for the animal? And then if the answer is yes to both, the landlord needs to provide the animal as waiving the no pets rule and cannot charge a fee for the animal.
So in terms of airline travel, when it comes to service animals, again, you should not have to provide any documentation for a service animal. The TSA staff are trained to ask those 2 questions that Meg talked about when she was giving the definition of service animals. You do need documentation to bring an emotional support animal on flight. You can bring a non-emotional support animal on flight. I think the reason people want to have their dogs labeled as an ESA for flight is because you don't have to pay the fee. So you might already have a letter, certifying your dog as an emotional support animal or your cat, whatever it may be. But a lot of the airlines have their own forms that you have to fill out prior to your flight. So if you have a letter, double check with your airline to see if any additional documentation is needed, and leave your mental health professional plenty of time to complete that and get it back to you before you travel. Here's an example of American Airlines, the form that's specific to them for your emotional support animal.
So Kate and I did a really deep dive into all the literature we could find on pet ownership and sort of the benefits of it, physiologically and emotionally, as well as the studies of therapy animals and support animals. And so the majority of the research is correlational and not causational. But across the board, the trends just show a more positive rather than a negative aspects of owning a pet or a support animal. And this slide just sort of summarizes the key points of our lit search, that owning a pet or engaging with a therapy animal did tend to stimulate the parasympathetic nervous system, which is associated with a relaxation response and counteracts anxiety and stress. Some of the studies with dog owners showed that dog owners tended to exercise more than non-dog owners by walking their dogs, which also helped them interact more in their communities and reduce their sense of isolation. And then, further down the slide, you can see that having a pet just helps a person have a structure, have more purpose and meaning, and just gives them some kind of activation in their day, because the pet needs to be cared for, fed, and walked. And then, as you'll hear from Elise and Becca throughout this podcast, their pets give them a constant source of companionship and just therapeutic benefit all around positive. And especially for a person with CF that's more advanced or somebody that's going through transplant, the pet is always going to be there for them when they're housebound or sick.
And I think we know from our life experience and our experience with our patients that people really do seem to benefit emotionally from owning pets, even if the science can't quite support it because it's so hard to randomize. So in terms of research specifically about people with CF and animals, there's not really a lot out there. We found a few studies and none of them were, really definitive. There was one study in 2013 that that sort of showed that people with CF around animals weren't at higher risk of getting more CF pathogens because of the animals. There was a 2014 study in pediatric patients that showed maybe the ones that had pets were a little bit more likely to show wheezing, but dog ownership wasn't associated with any bad outcomes. And the study in the end didn't discourage animal ownership in CF patients.
I'm going to focus on actually having a puppy or a dog post-transplant. There's a few issues that arrive that I wasn't even aware of when I made the decision to get a puppy. We had a previous dog who passed away September 11th, 2019. And when I checked with infectious disease, there were some things that they shared with me that I needed to be mindful of with having a new dog. Not that they discouraged it, but I should just be mindful about it.
It wasn't significant finding. And then there was one about APBA that showed maybe an association between pet ownership and more exacerbations, but it was a small sample size. When they repeated the study, it didn't show the same results. So even the researchers of this study didn't, say that people with CF shouldn't have pets. They just recommended screening people for pet ownership, informing them of this possible relationship. So nothing super definitive for people in CF.
When you consider a new puppy, puppies have lots of vaccinations. And vaccinations, one of them, the parvo vaccination, which puppies have to get, I believe they get 4 of them in their first year. It is a live virus. So a week after the dog gets the vaccination, being post-transplant, you need to be a little bit more careful when you're not to let the puppy really lick you. You still can pet the dog, but you need to create a little bit of distance. And more specifically is when you're trying to housebreak the puppy, that you need to be, if you can, have another family member pick up the daily duty, as I call it. The other issue that I was told is that this dog, unlike our previous dog, should not be sleeping in our bed. That was a difficult transition for me because I really liked having our previous dog Latte sleeping in our bed. But it was advised that we either crate train or have a little playpen, kind of a larger crate area off of our bed, and it would be healthier for me, as well as turns out that Teddy actually sleeps better in that area. We've trained him to sleep there and he's very, very happy.
Now I'm going to consider the steps that you would need to take to classify your pet as an emotional support animal. So the first thing you want to do is identify a mental health professional that you're working with. And this could be a person through your CF center, perhaps a community therapist, or some other mental health provider. And just going back to the information we presented earlier, just identify 1 or 2 emotional impairments that are improved by having the animal around. And this could just be what I mentioned earlier: depression, anxiety, isolation, motivation stuff. And then what the animal's influence does to mitigate those symptoms. And the examples here provides a routine, provides structure, helps me get out and exercise. It could be lots of things. And then also to consider what kind of plans you have in place for someone to step in and care for the animal in times of illness, or if you were ever admitted to the hospital. And this is a letter template that we came up with just based on all of the review of the laws and the literature search that we did. And this is a template that we share with our national CF community. It's been used by a lot of different social workers and psychologists. And so the letter, it needs to be on letterhead. and it needs to be provided by a mental health provider. And it just needs to state that the person has a medical condition. It doesn't have to be really specific about what it is, and that the person either has a related mental health impairment related to the medical condition or a standalone mental health diagnosis. And then in the last paragraph, the animal is essentially prescribed as part of the person's mental health care regimen, and it helps them manage their disease more effectively. And then it's always good for the provider to remember that they should make a statement about, excusing them from any kind of legal responsibility for the training and safety of the pet. And so we're happy to help any provider that may be struggling with what to write in a letter. Either, we can share it through the National CF community, or you can just screenshot this letter just for your own needs. And this is our list of references. Thank you so much for inviting us into this podcast. And now we'll turn it over to Elise and her journey of having a dog through her transplant experience.
Thanks for having us. Enjoy your animals.
Thank you.
Another benefit of having any type of animal is that I truly believe you become less self-absorbed. We're so used to thinking about our health all the time that we kind of get in these little spiral tunnels. And when you have a dog or a cat or a bunny or a bird, you have something else to think about and get yourself out of that mindset, especially when you're going through something challenging. You can pivot, that word's probably overused these days, but to a different mind thought and decide to do something that will make you feel better rather than ruminating over something negative that might be an upcoming procedure or a negative lab test. It helps you to emotionally get in a better place, I believe. But one of the things that I always say is there's nobody in your life that when you come home at the end of the day or the middle of the day that comes running to the door with his or her tail waggling and getting all excited to see you. Everybody else may be sitting on the couch and basically just say, hi. But the unconditional love and affection from a dog is really tremendous. And I truly believe it adds to one's life happiness, your emotional health, your physical health, and overall well-being. Most of all, what I would like to say is to enjoy your pet and have fun. They truly enhance your life experiences. Training your dog is a wonderful bonding experience. I joked that during the dark days of COVID that Teddy and I were going to run off to the circus when COVID was done, because he is so easy to train and loves to do tricks. And one thing is, a trained dog is a good dog, and a tired dog is when they get really exhausted from doing different types of training things, whether it's sitting, laying down, hunting for little treats in the house. And it also gives you a break from whatever you're doing. It's like a reset from the day. And I call it doggy meditation. It just clears your brain. And on all levels, dogs can add to your emotional well-being as well as your physical well-being.